Hi everyone, I am Dr.Waseem Sajjad. I am a diagnostic and interventional radiologist, and today we will learn about ultrasound probes. In the previous lecture, we discussed about echogenicity and ultrasound probe handling. In this lecture, we will learn and understand about ultrasound probes, probe orientation, and probe handling in detail. This lecture is very important for sonographers, sonologists, and basic ultrasound learners. So there are many different kinds of probes, but the two most commonly used probes are convex probe or curvilinear probe, and this is the convex probe or the curvilinear probe, and the other most commonly used probe is the linear probe. So we will study and understand these probes one by one. So let's start with convex probe or curvilinear probe. The name of this probe derived from its convex outer surface. So we call this probe convex probe or curvilinear probe. So a brief structure of the probe, if we discuss about the brief structure of the probe, uh, inside the probe, there is a piezoelectric substance or piezoelectric crystals. These substance or crystals convert the electrical energy into sound waves and then convert back sound waves into electrical energy, which appear as image on our ultrasound screen. So this piezoelectric substance or piezoelectric crystals are very delicate, so that's why it's very important to handle the probe with care. In case we hit the probe to some hard object or it is dropped by chance, there is a high probability that piezoelectric crystals will get damaged and it will affect your ultrasound image on the ultrasound screen. So first of all, always handle the probe with care. So the next very important thing to learn about the ultrasound probe is the to identify the pointing end of the probe. So in every probe, whatever company or whatever manufacturer you are using, there is always a mark, a light or some pointer which indicates the pointing end of the probe. So it is very important before you start doing ultrasound, it is very important first to identify the pointing end of the probe. So always identify the pointing end of the probe with the help of a pointer, with the help of a mark, with the help of a light, or in this probe there is this thing, that's a line which indicates that this end is the pointing end. You can see there is no mark on this side, but there is a very line or mark on this end, so this end is the pointing end. So in the previous lecture we discussed that the if we place the probe on the human body like this, then the structures inside the human body which are under the pointing end appear on the pointing side of the screen. Similarly, there is a pointer on the screen which indicates that this side of the screen is showing the structures alongside the pointing end of the probe. So after identifying the pointing end of the probe, the next very important step is how to place the probe. So there are two ways to place the probe on the human surface. One is that this is the transverse. You see, this is the transverse orientation of the probe. So, and this is the longitudinal orientation of the probe. So when we are doing ultrasound, we are basically rotating the probe between these two locations. Either it is transverse, either it is longitudinal, or it's a combination of transverse or longitudinal planes. So if we place the probe transverse, then The structures which are under the pointing end of the probe appear along the pointing end of the screen, and the structures which are on the non-pointing end of the probe appear alongside the non-pointing end of the screen. So if we place the probe and you see a lever margin on the pointing end of the screen, it means the lever margin is under your pointing end of the probe, and in this case the lever margin is along this end of the probe. So this concept will help you in the coming lectures how to identify different pathologies and different anatomic variants to place the probe correctly. So after identifying the pointing end and after placing the probe transversely or longitudinally, you can change the frequency of the probe as well. So we already discussed that the piezoelectric substances transmit the ultrasound waves at a certain frequency, and the range of that frequency is written on the ultrasound probe or on the ultrasound machine or on the ultrasound machine manual. It determines that this frequency of the ultrasound waves which are being transmitted from this probe can be changed between these two ends. So there is a button on your ultrasound machine. With the help of this button you can change the frequency of the ultrasound waves which are being emitted from the probe. So how this changing of frequency will affect your image on the screen? As you increase the frequency of the ultrasound waves, the penetration power of the ultrasound waves decreases, but the resolution of the images increases. And so always remember, when you are increasing the frequency, you are getting better resolution, but the depth at which the ultrasound waves can visualize structures decreases. The reason is that when we increase the frequency, the wavelength of the ultrasound waves decreases, and the wavelength decrease means there is a less distance between the crust and the trough of the ultrasound waves, and when this distance decreases, the reflection of the ultrasound waves will be more, and which will affect the penetration or transmission of the ultrasound waves. So simply always remember, when we increase the frequency, the resolution increases and the depth of the ultrasound image or the penetration of the ultrasound waves decreases. So when we need to see the deeper structures, we use convex probe or curvilinear probe, and it uses low frequency ultrasound waves so that we can see the deeper structures, but the resolution of the objects decreases with this probe. So the other probe is linear probe. If we need to see the superficial structures with higher resolution like subcutaneous planes or the subcutaneous vessels or the superficial veins, then we use this probe. This probe has a high frequency, but the depth of the ultrasound waves decreases in this type of probe. So you can't see the deeper structures, but you can see the superficial structures with higher resolution. So which type of probe you need to use depends upon which type of structure you are going to image. Suppose you are going to image liver or kidneys, these are deeper structures, then we use convex probe. And if we are scanning the thyroid gland or other superficial structures, then we use this probe because it has high frequency and high resolution, but it can't show the deeper structures. So if we summarize today's lecture, this linear probe is used to visualize superficial structures, it has high frequency, high resolution, but it cannot show deeper structures, and this convex or curvilinear probe is used to visualize deeper structures. It has low frequency, low resolution, but its penetration power or its ability to visualize deeper structure is more than the linear probe. So in this lecture we have understood that for which structures we use which type of probe, and how the change in frequency of the probes changes the resolution and penetration of the ultrasound waves, and how it affects our ultrasound image. So in the coming lectures we will discuss about the specific organs of the human body, their ultrasound, their normal ultrasound appearances and normal anatomic variants, and their different pathologies which we can diagnose on ultrasound. Thank you.